The most common cause of earache in adults is not ear infection, but most likely TMD or TMJ. Hi, I'm Dr. Joorabchi, and I'm here to give you eight easy tips for you to employ in your home or workplace to control your TMJ symptoms. The TMJ joint, or the temporal mandibular joint, is the joint that connects the mandible to the skull, and it's not so dissimilar to your knee joint. So the same stresses that can affect your knee joint, in a sense, can affect your jaw joint. It can get sprained, it can get strained, it can get arthritic. So you really want to take care of it to not go down that path. So now to get into the simple tips that can help your jaw joint, I'm going to start with the first one. That's icing and then heating the joint. Ideally, you take an ice pack like this and apply it to the jaw joint for about 10 to 15 minutes, 3 times a day for the first 3 days after the pain starts. Your second tip is a soft diet. So confine your diet to more softer foods, blended foods, casseroles, eggs, pastas. Stay away from raw vegetables, chewy foods like caramels or steaks, as this can overstress or overuse the joint. Again, think of your joint as a knee joint, and just if you have a sprained joint, you don't want to be overusing it, overstressing it. Apply that same idea to the jaw joint. If it's hurting you, you don't want to be using it. You in fact want to be resting it. And one of the big tenets behind that is having softer foods or eating softer foods. Also, cutting your food into smaller bites and using both sides of your jaws are also helpful too. The third tip is rest the jaw or relax the jaw. Generally, you want to keep your teeth apart. They should not be clenching or touching. So monitor your jaw position, especially while not chewing, to make sure that they're not unnecessarily touching. Also, good head and neck posture will make sure you align good jaw posture. So keep your ears in line with your shoulders, in line with your hips. Make sure you have good lumbar support when you're sitting. And when you're on the phone, avoid cradling the phone to your shoulder, as this puts strain on the jaw joint. Other methods you can employ to relax the jaw joint include yoga or meditation exercises. Some people find that local massage of your sore muscles can be helpful in promoting healing and mobility of the jaw joint. Your fourth tip is to avoid caffeine. Now, caffeine can tense the muscles, which will then put more stress on your jaw joint. So limiting your foods like chocolates, sodas, or even decaffeinated beverages that have caffeination in them, you want to limit while you're going through some TMJ discomfort. Your fifth tip, and probably the most important tip, is to be watching your habits, employing good habits. Now that includes clenching, grinding, resting your teeth together, biting the cheeks or lips, moving the jaw side to side, or tensing your jaw. Just like good ergonomics while sitting, good jaw ergonomics is going to be helpful for you to get over what you have and also prevent it from coming back. Number 6, you want to have good sleep habits. That means avoid putting your body in a way that puts unnecessary stress or strain on the jaw joint. So avoid sleeping on your stomach, and make sure that if you're sleeping on your side, that your spine is in perfect alignment. Number 7, do not open wide. Do not open your mouth wide. Avoid yawning, avoid yelling, avoid dental visits that require prolonged mouth opening. Again, going back to the analogy that this is a knee joint, if you're hyperflexing a sprained knee joint, that's only bad news for you. So you want to avoid excessively straining activities until the jaw feels right. And your last tip, number 8, use medications if your medical conditions allow. Medications like ibuprofen and Aleve are helpful in keeping your inflammation down, helping with pain relief, and getting you there faster. Use it on a short-term basis, and if need be, your doctor can prescribe stronger medicines or muscle relaxers to help you get there faster as well. I'm Dr. Joorabchi, and again, I hope you found this video useful. If you'd like to see any other types of videos, please leave your comments below. And above all, hopefully this video helps you with your TMJ treatment. Take care.